Well, I was diagnosed with Parkinson's about 8 or 9 months ago, I believe. And at that point, I didn't know really how I was going to deal with this.
So here at Mary Greeley Medical Center, we offer a program called LSVT BIG, which is a research-driven program designed to manage individuals who've been given the diagnosis of Parkinson's. The theme behind the program really is to normalize movement. It's high intensity, high repetition. It's an intense protocol where we see patients 4 days a week for a full hour session of therapy. In conjunction to that, there is daily homework that is required to be done, which include exercises, but also functional component tasks where we have patients participate in things that they would typically do. The research was initially started with speech-language pathology, and they really drove the loudness, and they tried to change how loudly people would speak by driving high intensity, high repetition.
LSVT Loud is actually where speech therapy is involved. This is when you're working with a patient with Parkinson's disease that might have difficulty producing loud speech, both at home, in the environment, and even at work. And it can make it difficult for them to have their wants and needs met because nobody can hear them. So I think a lot of times what can happen is a patient may feel like they're really speaking at their maximum effort, and they don't really think they have a problem, but they might notice from a good friend, a family member, their spouse, that they're really starting to tell them, you know, I can't hear you on the phone, Mom, or I can't hear you when you're in the other room, and they're starting to notice the other people around them, the difference. And I think that's when it's time that we should take a look and see if we can help to make that communication better.
With Parkinson's, people aren't aware that maybe they're not swinging their arm, maybe they're not smiling as much as they once were, maybe they're slouching a little bit more and getting a little bit smaller in their posture, and they may not be aware of that. And the reason that they aren't aware of that is because of an impairment in their ability to perceive how well their body is moving or not moving.
And the thing I noticed with Celeste was physically, I mean, it was clear from the pictures, and I didn't realize the extent to which I can only describe it as imploding, just sort of hunched over, looking down, you know, and it was really receding from social engagement. And I can really see and feel a difference.
We typically tend to drive amplitude of movement, meaning the bigness of the movement, really to reach normal. But because people are starting from such a small place, we try to drive big in order to normalize the movement.
I like doing the exercises. I also think they're good for my back. They're just good for me in general. And I've had family members say, boy, you're really perking up.